I'm Apshi and welcome to Health Matters by Malaysia Healthcare. Today I'm here with Dr. Shilpa and Che Puan Sarimah Ibrahim to talk all about women's health. This episode is in conjunction with World Health Day and we want to encourage people to take charge of their own health and experience Malaysia Healthcare. Thank you both so much for being here today. I'm really excited to have this conversation with you about female health and what happens to our bodies as we transition through life. So I'm going to start first asking you about general health. So Sarimah, I'm going to ask you first, how often do you do general health screenings?
I do it once a year, of course,
Every year?
as usual. But it depends, on how I feel. If I'm not feeling well, and I think there's something a bit, off health-wise, then I'll go for a screening. I'll do the extra that's necessary.
Yeah.
So it really depends on how
you
I'm
feel.
feeling. And obviously, different stage in my life. If I'm doing a lot of shoots and a lot of work, sometimes, you don't get enough sleep and stuff, and that affects hormones.
Not eating as well.
Not eating enough, exhaustion. Sometimes you burn out way before you even realize you've burnt out.
Yeah.
As a woman,
oh my
especially,
gosh,
right?
that's true.
As a mom and a working mom. And sometimes I burnt out to the point where I'll go to the doctor and I'll be like, I have adrenal fatigue. And then he's like, come, let's check you before you go labeling yourself.
The self-diagnosis,
I have adrenal fatigue and I think I've got maybe an autoimmune issue too. How do you know this? I Googled it,
Same.
Yeah, so, Dr. Google is better than anyone
Google,
else.
I tell you, it's terrible actually, So, but it's probably efficiency. It's okay, I'm online, I've got all these symptoms, but it actually makes it worse because then you
get
start
paranoid.
Oh my goodness, I have this. I'm dying.
If I have a migraine, is it brain cancer?
It's terrible, isn't it?
It's the worst.
But of course, that's the first thing you think of.
Cancer.
But honestly, I always say it's better to be safe than sorry.
Yeah.
So going for a screening or getting a checkup, there's no harm. And if my doctor looked like this and I was a guy, I'd probably have screenings every day.
Oh, every single
So
day.
Oh, you're so kind.
No, but seriously.
Yeah. But Dr. Shilpa, how often are we supposed to go for general health screenings?
Well, once a year is quite reasonable. Of course,
Okay.
if you're young and healthy and feeling all right, you may be able to delay it a little bit longer. But if you have any kind of symptoms, then obviously the first thing you need to do is see the doctor rather than Dr. Google. But once you get to about 35, 40, then you have to be aware of what your family history is predisposing you to. So if there's a very strong family of diabetes, high blood pressure, certain types of cancer, some of these things run in families. And it's much better to get ahead of it, detect it early so that it can be treated before complications arise. So definitely by the time you're 35, 40, start being aware of what's going on inside you. And if there are any symptoms, as you said, see the doctor earlier. But otherwise, once a year is quite reasonable because at least you're ensuring that everything's working all right.
Yeah.
And if it's not, you can get the help before it becomes a big problem.
At least personally, I'm always really scared, to go to the doctor. Because a part of me is I don't want to know, but obviously I should know because then I can fix
Oh my God,
it.
you're the opposite of me. I'm I need to know everything.
Yeah,
Tell
that's what I was
me
going to
now.
ask you. How did you feel before you went for your first appointment? Were you just yep, I'm going to do it?
My general
Your
screening.
general screening.
General screening's been a habit of mine for many, many years. So I always go and get your pap smear and stuff like that. I don't like doing pap smears though. They're so painful.
The secret to pap smears
Is?
is being relaxed.
That's not happening. That's never going to happen. Oh, you're just going to lie here and I'm going to stick something sharp inside of you. Relax. I don't think so.
It's
How?
because, if you're relaxed, the vagina relaxes. If the vagina relaxed, then it's actually just a very small instrument that slips inside.
Yeah,
but if you're tense, everything tenses up.
But how to not be tense? You know what I mean? Psychologically, my subconscious gets tense before my conscious does. I'm consciously you've done this before, you'll be fine. But my subconscious is there was one point that it hurt, so I'm just going to clench. And you're yeah.
Some women start singing. And that
Singing?
relaxes them. And then I do the smear. Within 2 minutes, it's all done.
It's all done.
Okay.
Wow. So pap smears once a
try
year? Is that how often
Once
you
a year
should
is
be
okay?
doing?
No, actually, the Malaysian schedule started by as soon as you're sexually active, once a year for 3 years, and if all three are normal, every 3 years.
Right.
But now we have introduced something called HPV testing.
Yes.
Now, human papillomavirus causes more than 90% of cervical cancer, and you get exposed to it as soon as you're sexually active. But it does take a while before it starts causing problems.
Wait, you get exposed to it as soon as you're active? Who's giving it to you?
Yeah, how does
Well, who else is
The
giving it to
dudes.
you? The dudes.
So guys are carrying
but
this.
guys-
This is what I
yeah,
heard.
they
Guys
can't
are
get
carrying
tested.
it,
Yeah.
and then they give it to you without them knowing.
Actually, everybody carries HPV. You carry HPV in your hands. You carry HPV in other organ systems as
Wow.
well. So if someone is touching your cervix, whether it's a guy or a girl, you can get exposed to HPV.
Right. So hence why you've got I think you've got the vaccine for it and everything.
But best for girls who have never been exposed to sex before.
Yeah.
Because then it is, like a
Protected.
vaccine for
Yeah.
something you've never been exposed to.
right.
It's like giving a measles vaccine for someone who's
Yeah.
already had measles.
Yeah, what's
No
the
point.
point?
Yeah. So, and it doesn't, even if you do get the vaccine, it may protect you if you've not been exposed to that type of HPV, but it
Right.
doesn't protect you from all.
All.
So if you still need to do your smears,
Yeah.
would you rather just do your smears, maybe not need the vaccine if you've already
Yeah.
got it? Mm.
So yeah, and so on that note, we went circular, but
No,
yeah,
but
I started because I was just like from young, you know
From
what I
young,
mean?
it
I
was-
think no, but not young enough to be honest. I only started like proper testing like maybe when I was in my 20s. Like, when you start learning and you're hearing more about things like cervical cancer and whatnot and breast cancer. I remember going for my first mammogram and going, ouch. That was the old school way where they used to
Oh,
like
yes.
put your boobs in this machine and squash them. And I was like, this is not good,
Yeah.
I'm going to have severe depression and anxiety.
Yeah,
It's
because
like
I think
PTSD
now they do
from it.
like an ultrasound on your
I
breast,
know.
right?
Now there's a
Well,
different way of doing it.
It's
isn't
not a different way. It's
it? You
just,
still get squashed.
you still get squashed, but the machines are a bit more sensitive. So they don't
Okay.
squash to the maximum. They squash until they get the image they want.
And so,
Yeah.
how often should you go for the breast ultrasound or mammogram?
Yeah, I need to know this.
Well, actually, you should already be doing breast self-exams even when you were younger.
Yeah.
Because
Okay.
everybody's breast is a little bit different. And
Yeah.
in fact, your own breast will change through the menstrual cycle. So when
Oh,
they tell you
yeah.
about your monthly breast exam, they ask you to do it at the same time every month.
Yeah.
Whether it's just on the
Oh.
first day of your
Yeah, so
period
it
or
doesn't
something. So
change.
it's that same that you're feeling every month.
And
it's
you would be
consistent.
Yeah.
able to quite like really tell if there
Can
was
you
something.
really?
Yeah, like it would feel really different, right?
It
Be
will
honest,
feel
because everyone
different.
talks about it, and I've tried, and I'm just like,
Half
this
the
is
time
this
you
is
don't
not
feel
happening.
Yeah, and then it's always I'm like, is that something that wait? It's on both
Oh, it's a
sides.
mole.
Must be the muscle.
Or then I'm like, is that a mole or is that what is that? And then
Yeah.
as you lose weight or whatnot, it starts changing too. So then you're like, is that breast tissue or is that something? So how do you know?
You
What's the
won't
best
know.
way? They say lift your arm up and all.
and it's also
What
your
about lying
underarm
down?
as well,
Yeah.
right?
No, you should lift your arm up because not only are you feeling the breast, you're also feeling under your
Under the
armpits.
armpits, yeah.
But what you need to look out for is anything that's different.
Mm.
To be honest, breast self-exam isn't going to pick up very early cancer or
Right.
even small growths that are a little bit deeper in. The ultrasound are much better at doing, and the
Okay.
mammogram is probably the best.
Mm.
But breast cancer is something that the risk increases as you get older.
Okay.
So more important, 40s, 50s, postmenopausal women, because 60 is around the time most women
So
get
you're
it.
okay then. You're only 20 something, but
Unless-
still.
I know I've only had one
History.
check in my life.
Unless
yeah.
you have a family history of breast cancer where people are getting it much younger.
So what is the test to check if like you are at risk for breast cancer?
It's the BRCA gene, but the BRCA gene is not the only gene responsible for breast cancer. And in fact, a lot of breast cancer is not gene related at all. Breast cancer, in fact, the biggest contributory factor for
Smoking.
developing, it's obesity.
Obesity.
That's a problem in
Wow.
Malaysia.
Oh yes, we are the champions.
Being why? Because of estrogen?
Estrogen, because
thought-
fat
see,
cells
I know
make
some things.
estrogen. You do.
Mm.
So it's additional estrogen stimulating the breast.
Wait, so
Yeah.
fat cells cause extra estrogen.
That's right.
Which then, that would mean men would also have an excess of estrogen.
Can
Yes,
men get
too.
breast cancer?
Yes, very rarely, but they
Mm.
can.
Hmm.
And uterine cancer. That's also
They can get
due
that too.
to not men cannot get uterine
Yeah.
They don't
cancer
have.
because they have
They
no
don't have a
uterus.
Yeah, but we
right.
can get it because
We can get it because of
being
obesity,
overweight.
and obesity.
Huh.
That's another incentive because everyone in society, especially women, we're just obsessed about being fit just to look good. But when you hear things like, your weight is actually correlated to an increase in cancer or not, wow, that's...
Just Google, if you want to Google something,
Yes.
just Google obesity and cancer and you will see the number of different cancers caused by being overweight.
Just slightly overweight or like you've got to be morbidly?
No, you don't have to be morbidly. In fact,
Really?
most Malaysians will fit the bill already.
Mm.
Do you know that in Southeast Asia, we are the fattest nation?
Yeah.
Yeah, I've seen that.
49% of men and women are either overweight or obese. And, you know, in this whole woke society, we're not supposed to fat shame, but it's not about exactly like you said,
Yeah.
how you look or how you feel. It is
Yeah.
really what damage you're doing to your body.
There is, like you said, you know, this sort of situation where you don't dare speak up about someone's weight because you're shaming them. But at the same time, whether you're too thin or you're overweight as a woman, both equally have, you know,
Yeah,
the
downsides.
risks,
Yes.
right?
Yeah.
And I feel like we're in a culture sometimes where we're so scared to talk about anything that might touch on fat shaming.
You can still be healthy if you're overweight, right?
Well, you can be, but then you have to be always worried about things like insulin resistance and
Monitoring
diabetes, blood pressure issues, cancer.
Yeah.
Yeah.
And
so-
something could happen then,
Yeah.
right? Because like if you are either underweight or overweight, then your predisposition is like Doctor mentioned also, if something comes to you, then it's probably going to be easier for you to get sick from it. So like if you're
Yeah.
overweight or underweight and you're a smoker, oh my goodness, as opposed to if you had the strength to fight the effects of that if you were healthy, say for example, in the
Yeah.
middle. So, but it's nature nurture too as well. I mean, these both kick in,
Yeah,
right? Like
and
what
you
activates it.
you actually build all the fat cells that you have in your life by the age of 2. So you don't build new
Yeah.
fat cells; they just expand and get bigger. So it's very important that
Oh.
infant nutrition is
Interesting.
correct. A fat child is going to be a fat adult, and it's not
Ah.
about trying to catch up and take care, because it becomes a lot more difficult because you're already programmed to be insulin resistant.
Right.
You're already programmed to have hypertension and diabetes and heart disease. And even if you eat the healthiest diet and exercise, you find that sometimes at 40, people who seem to be healthy still suddenly have a heart attack and die. And that's down to genetics. So you have to take care from the start.
So you're saying by 2, the fat cells that you're
The number
supposed to
of
have, the
fat cells.
number are already there.
Done.
Is that there because of what the parents are feeding the child, or is that there from in utero already? I mean, like programmed genetics.
It starts in utero and continues right up till the age of 2, just like brain development.
My goodness.
Wow.
So a
So-
mother can contribute to the child being overweight when she's already pregnant?
Yes. Especially if she's overweight when she's pregnant herself.
Right.
Wow.
Okay. So that's
This is a
something
lot
to
of
wrap your
new-
head to get
new
around. You know, like, I think a
information.
lot of people don't know that. They think
Yeah,
that
I don't think I've
you
ever
know,
heard
your fat
that before
cells
in my life.
increase, you know, as you eat more. I mean,
So
I
your fat
understand that
cells
they
just
expand.
contract as
They
you
get
lose
bigger
weight,
or-
as small.
They get
Yes,
bigger
yes.
based on how much sugar and stuff's inside, right?
Yes.
Interesting.
So that's an interesting, because you mentioned vegan just now, right?
Yeah.
But I have a lot of friends and people that I know who are vegan who have diabetes, because vegan doesn't mean you can't
No, it doesn't mean
eat
that
loads
you're
of
healthy.
pie.
Yeah, it also means you might compensate by eating a lot of carbs.
You do,
Yeah.
because
You
how
do
are you
eat a
going to
lot
get full,
of
right?
carbs. You do eat a lot of carbs, and vegetables also have a lot of carbs, but it's better to get your carbs from vegetables, rather than something that is processed.
Flour and sugar.
and sugar.
Yeah. Tastes nicer though.
Yeah.
Yeah, like a good croissant.
Okay, vegetable pie then. We'll meet halfway.
Without the pastry.
Okay, I want
you.
to just flip it a little bit. So I read that like thyroid disorder specifically is like more common in women than men, 8 times more common. I don't know if that's
That's
statistic-
right.
It's
Yes,
correct.
it is.
So what are some of the thyroid disorders we should look out for, and how do we know, like, you know, in Sarimah's case, like when it's actually thyroid, when it's not, like how do we make those distinctions?
Well, the thyroid organ is just behind your neck, and it is actually responsible for our metabolism and actually the functioning of every organ in our body. So
very
super
important.
it's very important. But it can either be overactive, a hyperthyroidism, or underactive, hypothyroidism. So too much is not good, too little is not good. You need to have it just right.
But it'll never be just perfect, right?
No, of course it's
Anything in the
perfect.
body. Or it is
Yeah,
perfect.
For most people, it works normally. If you look at the thyroid hormone levels, they're normal.
Okay.
You may be a little bit closer to low or a little bit closer to high, but if you don't have any symptoms and it doesn't make a difference, you don't need treatment. Because
okay.
actually your thyroid sort of self-corrects as long as
Oh.
it's all working okay. But you may have extra cells that are making more of the hormone. That's what hyperthyroidism is.
Okay.
And the most common one is something called Graves' disease. But you also may have a swelling that it becomes obvious before you have any symptoms. So if you have any kind of swelling that you're not sure about, that you think something has changed, your neck looks a little bit funny, just get a doctor check to see whether it is the thyroid that's enlarged or not. And an enlarged thyroid can be either a symptom, either a sign of overactive or underactive thyroid. So if you had an overactive thyroid, obviously it's everything that is high metabolism, fight or flight response, you know. You'll be sweating, your heart rate is racing, your pupils are dilated.
Super excited.
You lose weight, super excited. Anxiety is part of it. You lose weight despite eating so much of food.
That sounds kind of good though, right? Let's be honest, like losing weight despite eating a lot of food.
Yeah.
Not great, not great.
No?
Everybody like, all of
everybody
us are
is
like
like
50 and 60, like, maybe I could have hyperthyroid.
Yeah, and that's why you've got these doctors going
Sure.
around saying, here, let me give you this and keep your weight down.
So it's not healthy because in the
No.
long run, you are starving your internal organs the food that they need to function normally. You may cause other problems. So your thyroid needs to be normal. If you had an underactive thyroid, then it's exactly the opposite. You become very sluggish, you find it difficult to concentrate, you put on weight really easily despite not eating very much. I know lots of people are going to go check their thyroid hormones now.
Yeah.
But no.
But you've got to check it, doctor, in the right place, right? So can we I just want to understand a little bit, like, as a woman, how do you know where to check and screen correctly for your hormones and not to go and get this personalized screening whereby, you know, based on that day and that month, you might be given something that doesn't apply. So how does a person know?
Oh, that's a really good question, because actually you're opening up a little Pandora's box of personalizing hormones. So we talk about them in separate organ systems. So the thyroid hormone, you can take it any time of the month. It should be normal if you are normal.
Right.
If it's overactive or underactive, it will be apparent. And that needs either treatment or not.
Okay.
But for female hormones, it's a completely different ballgame, because in the menstrual cycle, the 1 month, whether you're pre-ovulatory, post-ovulatory, you have different hormone levels, different predominant hormones, and the levels are going to be interpreted according to when in the cycle you are.
Right.
So you can't say, oh, progesterone is really low on day 3 because you haven't ovulated yet. Progesterone is only released after ovulation. So it's not low, it's normal for that part of your cycle. But it may not be normal if you took that same blood test on day 21, for example. But if you just go to the pharmacy, to the lab and do a blood test looking at your hormones, you have no idea how to interpret it. But and some doctors or some practitioners take advantage of this and tell you that we're going to balance your hormones and we're going to give you a bit of this and a bit of that and you will feel so much better.
Right.
But in fact, rather than making you feel better, it's actually causing you harm. So if you're taking hormones at the wrong time of your cycle, you can probably stop even ovulating. Stop having your periods. If you have a genetic predisposition to having cancers that are hormone sensitive, you're going to make that rage and become apparent.
It can actually
of course
trigger the cancer. Wow. So how do we know then, as women out there, how do we know where to get the proper screenings done and how to do that?
Yeah, how would we know what's right and what's not? How do we make that distinction?
Your menstrual cycle is a very good indicator of how your reproductive health is. If you have a regular cycle, so that means the period around the same time every month.
Right.
Or if you can count that your cycle is 21 days on the dot, it may be twice in that 1 month.
Yeah.
But it is a cycle. It is your cycle.
Yeah.
Or some people may have a 32-day cycle.
Yeah.
Every single 32 days they have a period, and that is normal. So if you have a regular cycle, it is more or less an indirect indicator that you are ovulating, you are fertile, and you will have different hormone predispositions.
And you can kind of feel it in your body when you're ovulating.
Well, not everybody knows.
I feel like I immediately know.
Do you?
Yeah.
You're so lucky. My husband knows when I'm
lucky?
going to have my
Period.
menses still, because he's like, the alien is here. And I'm like, what do you mean?
That's
You're like,
awful.
This is
what
me.
does that mean?
So where's the sensitivity?
Yeah, what's going on?
No, but definitely during the second half of the cycle after ovulation, it's a progesterone predominance. So you will have also all the side effects from progesterone, which is
Bloating a bit.
bloating, water retention, sometimes acne, feeling sluggish, because your body is actually trying to maintain this uterine lining for baby to implant and grow.
Yeah.
So you're not supposed to feel great. You're supposed to just grow a baby.
You're supposed to just stay in a little cave and hibernate and prepare.
For a baby.
That would be
Whereas
nice.
but we live in this world, like you were
But
mentioning
here we are
earlier.
in front of cameras.
We're doing everything. Do you know what I mean? So I think a lot of us have to mask those natural symptoms, and that's the
Yeah.
sad thing. As
And actually, there are some women who are so affected by premenstrual syndrome, premenstrual tension, dysphoria, which is just feeling
Yes,
unwell, that they cannot function.
Yeah.
And they have to recognize that this is a particular period of the cycle where they need a bit of help.
Yeah.
I'm not saying, oh, I cannot work and I don't do this and you must leave me alone and
Yeah.
give me what I want. But you've got to take
Give me
charge.
what I want.
You have to take charge. Know that you have certain
Yeah.
challenges. Get help if you need it.
So, is there anything we can actually do to combat like thyroid disease?
You can't do anything to prevent it if you're going to get it.
It's just
And if you have it, then you need treatment. Sometimes you even need surgery.
okay.
Wow.
But this is something you can only determine when you see your doctor, get the levels,
screening.
maybe sometimes even imaging.
yeah.
And from a reproductive point of view, your menstrual cycles. So not just whether it's regular or not. So
So that's
is it
another
very
thing, that if you have
painful? Yeah.
irregular cycles, then you should screen for.
you should see what's going on,
Yeah.
what's happening. Is
Right.
it irregular because you have a problem that your ovaries are not making an egg every month?
Mm.
Or do you have some other condition that makes you not ovulate?
Yep.
Why wouldn't your ovary make an egg every month?
Something is suppressing it. One of the things
Interesting.
that's very common among school-going girls is stress,
Hmm.
especially around before the exam. Suddenly they have no periods for 3 months.
So nature just knows this is not a good time to get pregnant. We're not going to make an egg.
Exactly, because
Wow.
you are programming your body to fight that's right in
Yeah.
front of you. The least important function in the body at that time is
Reproduction.
reproduction, so it shuts down.
Hmm.
If you are very well competitive sports and you
Like an
are
athlete
not
or whatnot.
eating much and you're trying to keep a very lean frame for whatever reason, ballerinas, all of them,
Yeah.
you also stop having your period because your body thinks you're not even able to take care of yourself. How can you take care of
Yeah.
a child?
We're in starvation mode. So
Yeah.
I mean, I experienced that many times throughout my career.
Mm.
Yeah, haywire sort of.
Hey, why
in
when
the-
you're just
in the
not taking
cycle.
care of your
Yeah.
body and overwork, and I
Yeah.
guess trying to maintain something that
Yeah.
maybe your body just can't quite handle.
And then your
Yes.
body knows it's like, we're not going to get pregnant now because
It's not the time.
Not
It's not
the
the
good
time.
time,
Yeah.
obviously.
Mm.
It's amazing, right? The body,
It
how
is.
smart
It is actually so
our
amazing.
bodies are.
But now shifting more to later in life when it comes to menopause. So what are the phases in there? Like what's perimenopause? What are all those things?
Yeah, what is
Yeah.
perimenopause? Like I'm in my 40s
I'm
now.
perimenopausal.
I don't want to be paranoid about being perimenopausal, am I?
Yeah, what does that
How do
mean?
I?
No, perimenopause is just the period around the menopause.
Okay.
Now, menopause just means that the menstruation has stopped. I mean, that's the literal meaning.
Why do they call it
Menopause.
menostop then? Why is it menopause? It hasn't paused, it's stopped.
It stopped.
And it
It has
stopped.
actually stopped. Maybe it
So
was a
gentle.
kinder way
Yeah,
in
exactly.
the earlier years.
So gentle.
But-
Aw.
Well, until about 50 years ago, women didn't live past the menopause, so there wasn't really anything to
Oh
talk
my
about.
goodness, so it was a menostop.
Yeah. I guess as the life expectancy
It has
increases,
increased.
Wow.
you spend
We are
more time
In
beyond
menopause.
menopause.
Yeah.
So, unfortunately, as girls or when we're born, we have all the eggs that we will ever have for the rest of our lives, which means
Like fat cells.
yeah, that's it.
We have everything built in.
And so when it's gone, it's gone.
Mm.
And if there are no more eggs to be ovulated, there's also no more hormones.
Mm.
And the ovary makes 3 very important hormones: estrogen, progesterone, and testosterone. So every single organ in our body, similarly, are affected by these three hormones. Estrogen especially, because estrogen's what's responsible for skin and hair.
Feeling good?
Feeling good.
Right.
Estrogen is important for your bones, because as long as you have estrogen, your bone building is more than your bone loss. As soon as estrogen is gone, the bone building is less and the bone loss increases.
But
so
too
you
much
become,
estrogen, you've got weight problems.
Yes.
Okay.
No, but you have the estrogen that is enough for you from what the ovaries make. Don't have extra
Right.
estrogen from
We
the
don't.
fat
Fat
cells.
cells.
Yeah.
Oh.
Yeah.
Okay.
Okay.
So overweight women may tend to do better in terms of menopausal symptoms because they have a little bit of estrogen still coming from the fat cells. So they don't complain as much. They're very happy for a bit longer.
So they look younger longer.
But their bones will, there's not
Brittle.
enough to protect their bones. Certainly not enough to protect their heart. Because you see, when women under 50 or under the age of menopause, we're a little bit protected in heart disease because of our favorable cholesterol ratio. We have higher good cholesterol, lower bad cholesterol.
Right.
As soon as estrogen is gone, your risk becomes like a man.
Oh.
And your heart disease risk doubles as soon as you hit menopause.
And why do they say women in menopause like get cranky and stuff faster? Is it because of the estrogen?
Because hormones are very important for your brain.
I guess it's
as
like
well.
an
Yeah.
intense change from what
But you're
used
lowering
to.
in estrogen. Wouldn't
Yeah.
the body compensate with more progesterone?
No, there's no progesterone either.
Because the production is what
So
is
you've got more
ending.
testosterone then, because that's in the
you
brain.
have relatively more testosterone because some testosterone comes from the adrenal glands.
Yes.
But definitely not enough for what testosterone does for women. So testosterone is important primarily for sexual function. So
Okay.
libido, ability to
Drive.
orgasm, drive, but
Oh.
also personality traits. So motivation, ambition, being the go kind of person. And suddenly some women
am I
fear,
lower in testosterone now? Because I'm just
I
like,
know.
yeah, let's
I'm
just
gonna-
chill. Everything's good.
No, but some people feel a definite change in their personality after the menopause. Like they just
Oh.
can't be bothered to get out of bed and do anything
Oh,
when they
okay.
used to be very
Go-getters.
Yeah, before.
Okay.
Yeah.
But-
Well, I haven't gotten to that point yet, but I'd like to know what are the signs.
Yeah, what are the, like, I guess, how do you know if you're like menopausing at the right
Yes.
time? Are you menopausing too early? And if you're feeling it, like if you feel like, anxiety and all of those things, what are some of the ways you can treat it? Are there like treatments? Are there like, I don't know, what can we do?
Vitamins
That's a
and
lot
whatnot.
of questions.
Sorry,
there,
that was
but
like
we
1,
will
2,
take it
3 in
one
a
at
row,
time.
yeah.
Okay, so what are some of the signs? Let's get that out of the ballpark now. What are
Okay,
some
wait,
of the signs?
we will start with the age of menopause,
Oh no.
which is around 50.
oh,
Okay.
So 48 to 52. That's the average age of the menopause.
Okay.
But you can have an earlier menopause in some women, and some people with medical conditions even have their ovaries stop working at 35.
Right. Okay.
Or
okay.
if you've had surgery to remove your ovaries for some reason, then you might have an earlier menopause.
Okay.
Or if you have certain autoimmune conditions that are basically attacking your ovaries. Basically, autoimmune just means that your body is starting to build
Attack
antibodies
itself.
against its own tissue, whether it's your knees, whether it's your eyes, whether it's your bones, whether it's your ovaries. So when you have one autoimmune condition, you can be predisposed to others as well.
Yeah.
Your immune system is just working overtime and attacking itself.
Then you see the inflammation signs
Yeah.
and whatnot.
So average age 50, it can be earlier.
Okay.
But what you will start feeling as the estrogen gets less and less is, women experience symptoms first before they think anything is wrong, right? So you may have some hot flushes.
Is it like PMS?
PMS, you start having more pronounced PMS in the 40s
Oh.
before the menopause.
Yes.
Suddenly
gets
you're
worse.
Hence
so
the
aware.
alien
Yeah.
personality comes up for a day or two.
When you're younger, you have no
I love
idea.
how she's just like, oh my God, what is that?
Or like I'm just like seeing my future.
No, for the
No,
first
it can
few
be fine.
years,
Yeah.
like until 20s, you still
It's manageable.
you don't really care. Half the time, unless you're worried
that's
about
true.
pregnancy, you don't even know where you are in your cycle.
No.
Has your period come? Hasn't it come? Doesn't matter.
Yeah.
But when you're in your 40s, there is a perceptible change. And I
Yes.
definitely know I crave carbs more after ovulation.
Yeah, me
I
carbs
don't-
or salt. I don't know why. Why do I need salt?
It's
like suddenly
the
I-
water retention.
Ah, that's why. Exactly, because I'm always like, we need crisps. I need some salt.
Yeah. You start feeling a bit more bloated. You can put on 2 kilos in just water weight.
Well,
a suit that goes
overnight,
away.
you know.
Yeah.
Sometimes.
That's right.
Yeah, but that just comes right off.
Oh, please, come on. Not so fast, if
Not so
only,
fast
right?
anymore. She's so
She's
young.
so young. That just comes right off. I just sleep and wake up and it's gone.
Yeah.
No, darling.
No.
If only.
You have no motivation. You have no I don't know, I can't do anything today. So that's second half of the cycle.
Yeah.
Definitely more pronounced in the 40s. And then gradually it gets replaced by not having cyclical symptoms. They're just all the time. So estrogen is also important for vascular stability. So your blood vessels contracting, constricting and expanding, right? So because estrogen is less and less or gone, you no longer have control of how your blood vessels are working. So suddenly having a hot flash is, your whole face becomes red.
Whoa.
You have palpitations.
Okay.
They may last for about 15 minutes, 5 minutes, or even half an hour, but they go away. They come and go.
Wow.
So it's also that predisposes to the heart disease, because if you have vessel constriction in your heart, then this narrowing is going to cause less blood flow to the heart.
Is that why I hear like of other family members and stuff who've passed the menopause having heart issues
Yes.
later in life, and these could have been the strongest, most
Yeah.
athletic women.
Yes,
Yeah.
that's right.
Wow. Okay.
And it's not even your fault, because with the narrowing blood vessels, that's one. The other thing is that you've now got horrible cholesterol that is narrowing your blood vessels even further.
Oh, wow.
So
Why does this happen, doctor? Why have we got nature going against us? in
it's
this
not?
sense?
We're just living too long.
Yeah, I was going to say, it's probably just the end
okay.
of your life sort of slowly
That's
approaching.
awful though. It's like
Yeah.
I'm 50 and nature goes, well, you're done now.
Yeah,
Thank you.
can't have children anymore,
See you
means
again.
no point.
Yeah, I guess biologically that is the point.
And then
of-
men just continue on like
Yeah.
George Clooney or
Exactly.
whatever, and it's like silver fox, you look better as you age, you know, for all of them. And
No,
we're
it's
just
okay, we
like,
still
not
look
for
good.
all
All
of
of
but we
them.
still look good. We still look good.
not for all of them.
No, but not for. I mean, of course, like there are things you can do, like
Yeah.
exercise. I'm obsessed with
Exercise
Yeah.
is very good. It does make you feel better. It does help with the menopause as well.
Okay.
But going on hormone replacement is the other thing. I mean,
Okay.
women are living a lot longer than we did 50 years ago, for example. So before, your great-grandmother would never have lived to see the menopause because they either died of infection or at childbirth. That was
Yeah.
the
Very
normal
common.
cause of death.
Goodness.
Now with better healthcare, the fact that we're detecting medical illnesses, people are living longer.
Yeah.
The average life expectancy for a woman is between 80 to 90 years old now.
Wow.
So half your life now is without the hormones that make you what you are.
So we're very, very much in a generation of anti-aging, aren't we? Everywhere you go is anti-aging
Yeah.
this, and it's not just anti-aging for the looks; it's anti-aging for your body.
Yes.
like your actual, your liver. Anti-aging for this, anti-aging for your internals. Is it possible
Well,
to delay the menopause?
I mean, but like
you
how
cannot
long
delay
can
it,
you delay
but you
it?
can
Yeah.
get help. Because there are much better formulations of hormone replacement now
Yeah.
than we had 30 years ago.
oh, okay.
We have much more natural estrogen, much more natural progesterone. So just like what your body makes, just replacing it. So you don't think of it as medication. You just think of it as something that you need because you're still
Yeah.
alive.
How would you? So you basically you'd come in with the symptoms, and then they would. Is it like same for everybody? The kind of hormones that they would take, or do they have to test you for that as well?
We have to test to see whether you're there or not.
Okay.
Okay.
So if your cycle starts to change or you're noticing new symptoms, then do a blood test. See the doctor, do the blood test, and then see whether you're getting there. It may just mean that it's going to be another 1 or 2 years before the menopause.
Right.
Or it may mean that, yes, you're there. It's at the door right now. For both of these conditions, whether you're perimenopausal or postmenopausal, they can help you. Obviously, symptom relief is the reason most women see the doctor for the menopause.
Yeah, for the hot flushes or whatnot, right? I would imagine, and dryness. And,
Yes.
yeah.
I mean, if vagina's getting dry, there's no longer intimacy with your partner.
Okay.
And then that also doesn't make
It
you
also
very
affects your
happy.
mental health.
Yeah. So when you say natural hormones, I'm curious, like, what is natural hormones? I mean, where are they getting these hormones from? Synthetic hormones?
It's synthetic, but it looks just like what we make. And it's also delivered differently. Now, your ovary releases hormone directly into the bloodstream.
Yeah.
You don't eat it, right?
Yeah.
Hormones.
Yeah.
So now we have transdermal estrogen. It goes on the skin. It goes into your circulation through the skin, and it's delivered everywhere where you need it.
Just as you need it. Wow.
Oh my goodness.
So that would be the main treatment, would be a hormone replacement therapy.
That's right.
There's
But
that.
you have to make sure that you are not one of those people for whom this is contraindicated, which is basically breast cancer. If you've got breast cancer, nobody's going to give you hormones.
But exercise helps, right? I mean, because
helps.
I think
exercise
for the
releases
bone
endorphins, makes you happy. Exercise is good because it puts strain on the bones to forces it to stay stronger for longer. Exercise improves your circulation. Exercise helps your heart. So yes.
So basically,
so
keep
exercise
moving.
is very
That's what
important.
I say. Yeah.
Exercise, but you cannot out-exercise a bad diet. So nutrition is also very, very important.
My goodness, that line is just the bane of everyone's life, isn't it? Really?
Yeah, it really
It's like, I'm going to eat this whole entire pizza and then I'm going to run it.
Then I'll work out for like 3 hours.
Then it doesn't remove the cholesterol, etc. and whatnot, and preservatives.
Yeah. Eat clean.
Eat clean.
Your body doesn't know what
For
to
some
do.
people, eating clean means just clean the plate and then put your fried chicken on it nicely.
Lick the plate clean.
Yeah, exactly. Lick it clean, right?
I just want to wrap this up because, this episode is in conjunction with World Health Day. And, on a larger scale, like we said earlier, women are the caretakers. In so many ways, I don't want to be sexist about it, but we are the backbone of a lot of the support in society. You look at mothers, wives, friends. As much as men support us, they definitely do. Women also play a big role in all of this. So what do you think, what would you want to put out there for women when it comes to their health?
Well, we're living a pretty long life on this earth. So you not only want to equip yourself with good mental and physical health to be able to live it, you want to be able to enjoy it.
True.
And so you can't just take it for granted. You've got to take care of your body. And to take care of your body, you've got to make sure that you don't have any illnesses that can probably jeopardize this journey. I mean, if you drive a car, you take it for servicing every year or however long it is. You should do the same with your body and respect it.
Just reclaiming your own health.
Take charge of yourself. Take charge of your body. Take charge of your health.
Yeah. I think we're also so lucky in Malaysia. We have such good healthcare, both in the public and private spheres. If you can't afford it, there's affordable healthcare. If you want something a little bit more luxurious, we have beautiful hospitals. In so many ways, we're so lucky.
We do. I mean, we don't want to just survive as people, right? We want to be able to thrive. And it's true. As per what you said, in Malaysia, a lot of people that I know that live overseas and family members that I know, they struggle when they're trying to get an appointment, be it to see a mental health professional or general medical professional. They're waiting weeks to see a specialist, sometimes months.
Yeah.
Whereas here, you can just call up and you could possibly see a doctor today or even tomorrow, see a specialist. And
definitely.
I think a lot of people don't know this and they go overseas or they look overseas, but when they actually should experience Malaysia healthcare.
Yeah. Thank you both so much. Thank you, Dr. Shilpa, and thank you, Sarimah. It's really been, I'm sure you saw my face this whole episode, just whoa, getting my mind blown. This was so informative and so amazing.
It was such a pleasure to be here and to meet you both.
Thank you so much. And for those watching, this has been Health Matters by Malaysia Healthcare. Thank you. Bye.
Bye.
You can take charge of your health by getting a health screening while you're on holiday. Healthcation. So what this means is you get to enjoy a super fun holiday, beautiful hotels, fun tourist attractions, all sorts of wellness activities, think spas and saunas, but also taking care of your health by getting your health screened at one of our amazing hospitals here in Malaysia. So what are you waiting for? Book your healthcation today. And for more information, check out www.malaysiahealthcare.org.